The world's biggest government-funded health scheme, at least that's what India's Prime Minister is saying. Tapping into all the fervour of India's Independence Day, Narendra Modi's spoken of 500 million poor people being covered by this scheme. But there is criticism, with some just calling it a gimmick. And as Andrew Thomas reports from the northeastern city of Guwahati, there's also concerns India's health facilities won't even be able to cope with the rise in demand.
India's Prime Minister Narendra Modi doesn't call it Modicare, but everybody else does. His ambitious National Health Protection Scheme will be the centrepiece of his re-election campaign.
The poor of the country will not have to struggle when they fall sick. They will not have to borrow from moneylenders. Families will not be destroyed.
The scheme is due to start in late September and will become the largest publicly funded health service in the world. In effect, the government will pay the premiums for health insurance for 100 million Indian families.
Each will get a policy that covers their medical costs up to the equivalent of about $7,000 a year.
At the moment, only the well-off have access to insurance to pay for treatment in a private hospital like this.
I'm lucky. I don't have insurance, but I can afford this. My husband has a good job. We own our own house.
The new programme will cover the poorer half of India's population. For private hospitals, the scheme should see a big boost in business, but there is concern they'll be overwhelmed by demand. India spends just 1.5% of its GDP on healthcare, compared to a global average of 6%. Facilities and staffing levels in the health sector are poor, but that, say doctors, is changing.
There is a lot of concern regarding the human resources, but I think within 10 years or 15 years, our health sector will be in a world-class health sector.
Some have accused Narendra Modi of caring more for his Hindu base than for other ethnic groups or India's poorest. With healthcare for all, he's trying to change that image. If it's a success, it would be a big achievement. Andrew Thomas, Al Jazeera, Guwahati.
Narendra Modi took office in 2014. He promised a lot under the slogan, "Good days are coming." Now, this infographic I've got for you from AlJazeera.com takes into account what he managed in his first year. Have a look. He was talking about things like, and he did manage, making it easier for people to open bank accounts, opening a biometric ID system, which is no mean feat in a country of over 1 billion people. And then he promised a lot of other things: tax reform, road building, drawing in 100 million tourists, constructing toilets, even all the way up to, or down to maybe I should say, bullet trains, should he still be in office in the year 2022. Let's discuss all of those promises and what we're seeing now as well with Sreeram Chaulia, who's a professor and dean at the Jindal School of International Affairs and the author of the book, The Modi Doctrine. Nice to have you with us, Sreeram. First of all, what do you make of the healthcare policy? Because that's a big one. I mean, once you start promising your people better healthcare, you've really got to deliver on that one.
Oh, sure. It's a massive challenge, and I think it is fitting our Prime Minister's personality style as a politician, because he tries to conceive and implement policies that touch massive swaths of people. You're right, 500 million people is what we're talking about. And it's a big ambition, macro picture, and a lot, of course, will rely on nuts and bolts at the grassroots, as your reporter just mentioned. But one thing is for sure, he sees himself as a transformative leader who has some kind of a sense of manifest destiny. And I think he's this Modicare, it's going to cost apparently 1.7 billion US approximately per annum. Many may say that, it's fiscally reckless and so on, but I think he's been able to balance it because he's also kept the markets happy. He has kept international investors and rating agencies going gaga about him. At the same time, he's doing this welfare politics. So in a way, it's the election year that's coming up in the next 6 months, as you mentioned. So I think he's trying to cover all the bases and to fortify himself as an unchallengeable and unassailable leader at the national level with this big picture about changing the country for the better.
But I wonder if that's just the problem. You use the phrase they're covering all the bases, and I wonder if there is a risk of Narendra Modi over-promising and under-delivering. I mean, politicians can always run that risk, but with the sheer amount of things that he's promised.
Yeah, I mean, there are some skeptics who say that, it's all rhetoric. But I think if you look at the grassroots sentiment, certainly the beneficiaries of these welfare politics do appreciate the handouts as well as some of the systemic and structural changes that he's trying to enact. And I think there is still a sense of hope and optimism about the changes. I mean, the space program, for example, it's going to approximately cost $1.2 billion. And some might say that, we need toilets ahead of a space program. But then Modi has also done the other thing, which is to increase the usage of toilets and installation of toilets in rural areas and to improve sanitation. So that's the magic of Modi in the sense, because he's able to, hunt with the hares and run with the hounds, so to say, because he has this capacity to catch all and different segments of the society. And definitely a lot of these moves and the measures are aimed at working class people. And as you mentioned, going beyond the core base of the Hindu right, and now he's at the center in many ways, and he's trying to say that our time has come and we can shine in the world. He spoke about how the space mission will take India to the 4th place in the world after China, United States and Russia, and he keeps mentioning this repeatedly, that this is our time to really gallop ahead, both in terms of economic development, but also in terms of power projection in the world. I think his vision is basically to make India a major global power. Right. And he's trying to convince the society that we are on the right track, and he needs their mandate one more time next year to continue this good work.
Sreeram Chaulia joining us today from Sonipat in India. Thank you for that.